Entrepreneurially Thinking is a presentation of BioSTL and CET, the Center for Emerging Technologies, with raregem-productions, changing the way you view new ventures, including you on the pathway to success with your business in the St. Louis marketplace and beyond. Here's your hosts, Cheryl and Christy. Now let's get thinking entrepreneurially.
Welcome back to the Entrepreneurially Thinking podcast. Our goal is to energize your entrepreneurial mindset and create pathways for business success in the St. Louis marketplace and beyond. I'm Christy-maxfield.
And I'm Dr. Cheryl-Watkins-moore with BioSTL and the Inclusion Initiative. Hey there, how you doing?
I'm good. How are you?
I am well.
Well, and you know what? We just found out that we are building our listener base.
Yes.
1 7-year-old at a time.
Yeah.
I'm so excited. We'll tell you more about that because our guest was just sharing how we are among the playlist options.
We are special.
For her kids. And so, needless to say, we are excited to have listeners from all walks of life, all ages, ready to step outside their comfort zone. We've got a fabulous lineup of guests, and our listenership keeps growing. So we're really glad to be able to come to you with the support of our founding sponsors, BioSTL and CET.
Get a big shout out there.
Always something good going on. We've got the Square One program. We've got the BioSTL Fundamentals, Online Startup Toolkit, Global STL, Inclusion Initiative, Vision Conference.
Oh my gosh.
Yeah.
If you're not plugged in, there's something wrong.
I actually attend way too many meetings with you. Not that I don't love you, but to do all that means I meet with you a lot.
We see each other not too much.
Not
it's
too
good.
much.
It's good.
Just right.
2 bodies, 1 brain, as I always say, right?
So we want to make sure that you're also spending quality time with us because we can't spend enough time with our listeners. And so find us on your favorite streaming platforms, iTunes, Spreaker, Facebook, LinkedIn. And entrepreneur Gary Vaynerchuk says, voice is the future. The future is voice. So shout it out.
Absolutely. And invite as many people as you know to download and subscribe.
Absolutely. So who are we talking to today?
Well, the Essential Atlas of Physiology
Which I know you read on a regular basis.
That's in my, it's
bedside
part of
table.
Exactly. Says we can thank Aristotle, and I am a big Aristotle fan, right?
Okay, keep going.
For the saying, heartfelt.
Who knew?
Yes. This originated from his philosophy that the heart collects sensory input from peripheral organs through the blood vessels. Let's jump from Aristotle to talking about the heart. The heart is an amazing organ that pumps oxygen and nutrient-rich blood throughout your body to sustain you. Those who study the innermost part of our existence has a remarkable responsibility and challenge. So, how to best apply science to helping others live? Our guest today incorporates something I think which is totally phenomenal. Dr. Silva is a wonderful human being who I met not too long ago. She is a fabulous woman who is not only a scientist, a doctor, but God, she is a visionary. She has taken technology that kids play on their video games and been able to take that technology and now use it in heart surgery. So we're going to be talking to her. So stay listening.
CET, the Center for Emerging Technologies, is a proud founding sponsor of this Entrepreneurially Thinking podcast. We want you to know all about the great things they are up to. CET is in the business of entrepreneur development, offering a variety of programming to meet the training and technical needs of early-stage entrepreneurs. These programs include the Square One Ignite and Bootcamp training program, Level Next, technical assistance, workshops, and other educational programming. To learn more about CET, the Center for Emerging Technologies, visit CETSTL.com. And for your renewed and continuing support, CET, we say thank you.
My name is Jennifer-Silva. I am the CMO and co-founder of Sentir, and I am an assistant professor of pediatric cardiology at Washington University School of Medicine. Entrepreneurial thinking to me means thinking outside of the box and not being worried to fail.
Joining us today is Dr. Jennifer Silva, an associate professor of pediatric cardiology at Washington University School of Medicine, and she is the co-founder of Sentir with her partner and husband, Jonathan Silva, who is also an assistant professor of biomedical engineering at WashU.
Wow.
I know.
These two are just unbelievable.
And Sentir, their unbelievable thing, is developing into the first intra-procedural use of augmented reality in surgery. They're using the Microsoft HoloLens to be able to display the patient's specific heart image in real time to be able to guide catheter locations. Am I getting this right?
Yeah,
Dr. Silver's nodding her head yes, so I'm getting this right. And over the course of her career, she's been involved in multiple emerging technologies. And really, Jennifer, we need you to tell us all about that. So welcome.
Thank you.
Thank you for
having
coming.
me.
Absolutely.
Thank you.
So what does all that mean that I just said, that you're developing this first intra-procedural augmented reality surgery catheterization hologram of my heart?
Yeah.
And
There's a lot of words.
There's a lot of words, and really, once you get to hologram, I'm on holodeck, and then
there's a lot of big words.
So what does all that mean?
Yeah.
So what it means is, well, let's just start with what I do.
Yes,
so what I do is I take care of kids who have heart rhythm abnormalities.
Okay.
And those heart rhythm abnormalities can be either too fast or too slow, but either way,
not good
in either direction. Right?
Okay.
Goldilocks phenomenon. So the way we take care of kids who have heart rhythms that go too fast is with a procedure. It's a minimally invasive procedure, which means that we don't cut them open.
Right.
We don't cut open their sternums and look at their hearts and do that. But we go through tiny little ports, or basically through IVs.
Okay.
And then thread catheters through vessels and make these detailed maps of their heart, mapping out the normal electrical systems of their heart and then the abnormal electrical systems that promote these abnormal heart rhythms.
So the nose.
That's really cool.
Yeah, no, this is, I
cool.
do have the best job ever.
Yeah.
It's so much fun. And it's impactful, right? Because
No kidding.
nobody likes it when you feel your heart beating fast.
Right.
It might not.
Oh, I hate that.
You feel bad. And sometimes it can in fact be fatal. And so it's a really great opportunity to take care of a really great population, right? So kids are fun and they're communicative and they sort of bring a joy to it, which is great. But then there's the very serious part of it, which is taking care of heart rhythm problems. So the way we currently do that is we do it using X-ray, or these maps that we create through these mapping systems. And these mapping systems were this huge game changer for the field that I'm in, which is a fairly young field.
Okay.
Right. So if we think back to the history of cardiac electrophysiology, the people who first started doing these catheter ablations are still practicing catheter ablation.
Wow.
So
it's not even really been a full generation.
No,
then.
it's not. It's not. And that's what's exciting about it. So just even within this generation, we went from being bold enough to think this was a possibility to developing the tools to do it, to where we're hoping to take this even further. And what we've said is, look, it's hard.
Yeah.
It's hard doing these things when you can't see it and you can't touch it and you're interpreting all of this data from all of these different data sources. And we knew that was hard. And that's partially why we like it, right?
Yeah,
we like hard things. We like things that are challenging.
And the body is always, the body has so many different systems. And
absolutely.
They work differently for everybody, right?
Right. And so even, you can memorize a certain thing, but then it's in that particular patient. And in that particular patient, it's just ever so slightly different.
Right. And it's kids, so it's smaller. Everything's on a smaller scale.
It is. So I know the challenges in our field. And so part of the fun of being in a young and evolving field is that technology is constantly sort of running off in one direction. Some are really positive. Some are dead ends, but that's okay. You've got to chase them all down. Right. So about 2 years ago, my husband, who's an engineer, went out to the Microsoft Faculty Summit, Microsoft Faculty Summit in Seattle. And they were demonstrating their new technologies. And one of their new technologies was the HoloLens, which was an augmented reality headset. So, and they actually, at that point, showed a hologram of a heart.
Oh, connected all the dots.
Yeah.
Right. And so he looked at it, and
he immediately thought of his wife.
Well, he immediately thought that was a wrong hologram. The heart wasn't beating properly. And
he was like, "That's broke. We got to fix."
Yeah, he's like, "That's just not right."
And he is not a surgeon. He is a biomedical engineer.
He is. He is a scientist.
But he clearly knows how the heart works, and he knew that one wasn't working good.
Yeah.
I wonder if because of his wife.
Well, that's right. So you can't help when you work in similar fields to talk about it. And I'm, none of us are any different. We go home at the end of the day and we are happy with the things that worked. Right. We complain about the things that didn't work. And so over the course of our marriage, I had serially complained about things in my job that weren't working. And he saw a tool that he thought, well, maybe this is helpful. Right. And so, he called and we started talking about it. And it really seems like a very clever idea. And I thought, well, okay, we need independent verification.
All right. And so who independently verifies that a hologram of the heart?
Right. So that's like, cool.
Other than like looking at it and being like, hey, that's cool. Let's actually use it in surgery.
So I have a partner that I work with here at WashU at Children's. And he's my senior partner, and he was part of that original group of people who did catheter ablation in children. He was actually the first one. Yeah. So we walked into his office, and I was like, we've got this idea. And he was like, sure, go ahead, spit it out. So we told him, and he looked at us and he said, well, if you could pull that off, that'd be something. And so we
Gauntlet
walked out.
Thrown.
Right. That's right. And so then we felt like, okay, it wasn't just us who thought this was a good idea. This is somebody who's a leader in our field and my mentor, right? And so I value that opinion.
Right.
Yeah.
And then he did just that. He basically, he waved the red flag and told us to go. And so we did. Off we went.
That's amazing.
Here we are 2 years later.
Wow. So what does it take to go from, we talked briefly while introducing you about being around all these emerging technologies, right? And you just described that your field is essentially always evolving technologically. Is this the first time you've looked at that technology and said that actually could be a business?
So yes. So in the way I've always approached this is I came at this as a clinician, right? So I came at this from the standpoint of my day-to-day job is seeing patients and taking care of patients, whether it's doing a procedure on a patient, whether it's seeing them in clinic, whether it's seeing them in the hospital. That was my day-to-day. And so I was looking at all of these technologies that were either on the cusp of development. So another team had sort of taken them through those very early stages.
Okay.
Or that had been developed and were just sort of emerging on the market for adults. And I said, okay, and this is fairly common, I think, for a lot of pediatric practitioners, is that we look at the tools available to us and then we have to repurpose them for our purpose.
Sure.
Because you're dealing with tiny people, tiny organs, tiny vessels.
Tiny market. Right.
The whole thing.
Right.
Tiny market.
Right.
And so that's part of the creativity of it, though, right? So a creative person looks at that and sees a challenge.
Right.
One that's surmountable. And so, we had the opportunity to partner, for instance, with AliveCor. So AliveCor developed the smartphone wireless ECGs.
Oh, yeah.
And we trialed that in infants, even. So infants, toddlers, school-age kids, and we're able to show some really great results. And so that was an example of an emerging technology that hadn't quite found its space.
So how do you guys find, does the technology find you, or do you guys go out and find the technology? Being at WashU, I think, is helpful as well.
I think anytime you're surrounded by people who love science, you can find the technology, but then it sort of feeds on itself, right? So when you find technology and then can apply it in a novel way, people sit up and say, oh, that's somebody I can ping with an idea and see what they can do with it. And so it starts feeding itself.
Wow.
So you've essentially cultivated colleagues who are not only they're creative and inquisitive and curious and essentially entrepreneurial, even if it doesn't mean that they've started a venture, because sort of the nature of your work, but also the nature of the network you've cultivated is based in this curious, push the boundaries. I mean, what you said was that's a creative challenge and it's surmountable.
Right.
And we're talking about children's hearts.
Right.
Right. Things that some folks might say, well, that sounds good, but not now.
Right.
Not now.
Right.
Not with this in this way kind of thing. And you're like, oh yeah, bring it.
Right. So Sentir is clearly the most traditional method of entrepreneurship in that we had an idea.
Right.
We developed the idea. We developed the intellectual property.
And now you're commercialized.
Do you know what I'm saying?
Yep.
So it probably was the most traditional, but I don't think that we could have done this unless we had done all of those other things before and had learned along the way of seeing a product that hadn't been taken through the FDA, but how are we testing that in adult patients and pediatric patients? How are we taking a tool that has FDA approval for projects for population A, but applying it to population B and working through that regulatory path? So we had done a lot of parallel work in adjacent spaces, and this was sort of bringing all of those pieces together. And mind you, there was still so much more to learn, but taking all of those lessons and moving something forward.
And I love that because I spend a lot of time talking with even entrepreneurs, people who would say, I already have an idea. Why are you talking to me about how to have better ideas? And I say, because, it's a practice, right? We can practice being entrepreneurial in our mindset and in our approach to our world. And the adjacent possible is actually one of those concepts we explore, that you not only see the adjacent experience and the adjacent learning, but in this case, the adjacent, wow, we've got hologram and augmented reality technology. We have all these maps that we've been making with electrical stimuli and other imaging tools. And these live in this adjacent possible space where there's still a big question mark in the middle.
Well, that's what I was going to ask you. Were there any precursor technologies that was using holographic imagery? Or are you guys the first?
Yeah, so this is actually a really interesting question. So this feeds right into the question that you had asked about, do you find technology or does it find you? So for those of us who sort of just sit right on that edge, people have been promising virtual reality for
a long time.
Right.
Decades, right? Like I remember as a kid,
like holodecks, like really, like we've been talking about
very
it
Star Trek-y.
Very Star Trek-y.
Absolutely. And so for those of us who had sort of watched there's actually a word for this. It's called the extended realities continuum.
Ooh, I love that.
That sounds very Star Trek-y.
It is. So, there was standard virtual reality, which was a black box, right? Where you inserted yourself into this new environment that was totally detached from where you were. So that's not tenable, really, in the medical environment, right? Nobody wants their doctor to not be there.
Generally speaking, not so much.
Right, not a good idea.
Kind of really want you there.
The next thing that happened was augmented reality. And a good example of that was Google Glass.
Yes.
So for those of us who were sort of, watching it from afar, we saw Google Glass. And I remember exactly the point in my career I was when Google Glass came out. And I thought to myself, oh, this is it. And I'm not ready. Right? I was too young in my career to drive that. And it didn't work. Like
it wasn't ready either.
It wasn't ready. The technology wasn't ready. You have to have a match between the problem and the technology, and it wasn't quite there.
Yeah.
But there were these one-off case reports of people that were starting to think, how can I use a tool like this in my practice? The next jump in that continuum of realities became what is now called mixed reality.
Yes.
So mixed reality allows you to be in your natural environment and then to import digital images into it.
So Doc's with you, which we said we like.
Right.
And now the Doc can bring in all of these other tools to the environment.
And now with mixed reality, you're empowering the doctor to manipulate all of those tools.
Wow. Wow. There's a lot to talk about.
There is, and we're going to continue that in just a second.
BioSTL is a proud founding sponsor of this Entrepreneurially Thinking podcast, and we want you to know all about the great things they are up to. BioSTL fosters collaborative efforts to advance innovation and entrepreneurship that builds on St. Louis's world-class medical and plant biosciences. Their global STL initiative aims to build a direct link between St. Louis and other countries by recruiting high-growth international companies to establish a United States presence in St. Louis. You can learn more about BioSTL and the Global STL Initiative by visiting biostl.org. And for your renewed and continuing support, BioSTL, we say thank you.
So now the technology is at a place where the physician and the technology are actually operating on the same plane. Mm-hmm. But you're now using it in ways that give you far more information than we've ever had.
Right. It's not additive.
Okay.
That's what's
what
interesting
does that mean,
about it.
That it's not additive.
So when we started, we thought, okay, this is going to add to the information that I need when I'm doing a case.
Okay.
And what we found through our initial experiments was that it was exponential in what it was adding to the case. So we thought, okay, very basically, we're going to improve the way people are seeing the heart because we're going to take away the guesswork. Instead of looking at an X-ray and having to mentally recreate what that looks like in 3 dimensions,
sure,
I'm just going to give it to you. Mm-hmm. Right? I'm going to give you the 3 dimensions. And that was very cool. Don't get me wrong. Like the first time I saw it, I was
you were like,
tickled. Yes. I was so happy. But then the interaction piece what became a bigger part of what we were doing.
Okay.
So Jennifer, first of all, when you said it was more interactive, was it 3D modeling that you were looking at, or was this more, had you...
Holograms.
It was holograms.
It was holograms.
At that time. Okay.
Yeah, we went straight to holograms.
Okay.
We blew right past 3D modeling.
Okay.
Wow.
And went straight into holograms.
Because that's where I thought you started and went to holograms.
No.
Wow. Okay.
So we actually had a really great conversation very early on with a great guy actually out at Case Western named Mark Griswold. And he developed the Holo Academy, which is a cadaveric hologram that medical students are using for medical education purposes.
Yes. And when I say you moved right past 3D, does that mean like you're in it versus looking at it?
You can do both.
Okay.
So you can either look at it or you can decide to interact with it and make it so big that you can walk through it.
That's very cool.
Yeah.
So for our lay people out here, it's almost like when they use the holographic imagery for, Michael Jackson now coming back. Michael Jackson is up there dancing, and you see him there.
And you see it all in 3 dimensions.
You see it, you hear it.
Right. That's how you're visualizing and seeing the heart.
Correct.
That's very cool.
Yeah.
Very cool. Wow.
So it's not additive, meaning that it does way more than just
it does way more than just add. And that's been the really interesting part, is that we've done this, and so our internal data we always, everybody worries about that. Everybody who's sort of testing their own device says, okay, that's all well and good, but now let me put this in other people's hands. And that's what's been really telling, is putting this in other people's hands, and in people who've both been doing this forever and who are really young in the field, and then everything in between in that space. They're all teaching us things that they can now learn and do with it that maybe we didn't initially anticipate.
Right. Wow. And recently there was a report talking about the ethics of technology, and it was in the context of Facebook and all of the things that have been coming about how data is used. And one of their points there was that teams need to be formed that can help foresee how technology might be used beyond their thinking.
Yes.
Right. And they were saying it in terms of, you have to think of what bad actors would do with it, as well as what good actors with different brains would do with it. And it sounds like in your space, good actors with different brains are actually pushing the envelope on what is already a cutting edge technology.
I think that's right. And you always have to be worried about bad actors. And I will say, much to the FDA's credit, and I know that the FDA gets mixed reviews depending on what where you are in your process.
Right.
But they have been, I have to applaud how they've taken on the issue of cybersecurity.
Interesting.
They've really tried, and there have been issues. And so because of that, they've tried to get very far in front of that. And so they are trying to address the potential issue of bad actors.
And I think that's interesting because with the FDA, usually they lag technology. How are they looking at, because what are you guys classified as? That's really interesting.
Sure is. It was a really interesting first conversation we had with the FDA, too.
What are you?
Yes.
What
Are you a device in the world that your husband?
Right.
Like biomedical engineering? Or are you an intervention or a medical procedure?
We're a device.
Okay.
We're calling ourselves a software
really
device.
A software device, even more interesting.
Yes, but there's clearly a hardware component.
Yes.
And so that can't be overlooked. And so I think...
But you're not implantable, which is
We're not
great.
implantable, which is, yes.
Very good.
Critical.
Right.
Mission critical. The FDA, I have to say, I'm sure that everybody has their own experience. Our experience with them has actually been incredibly positive.
That's wonderful.
great.
They've been very collegial. They've been very collaborative. They've been responsive.
And I'm guessing that's because you guys have made that a partnership.
We have.
Yes.
And we've worked hard on that, and we continue to work hard on that. But I think that, and I'm speaking a little bit for them right now, but I think they see this as coming.
Right.
And so, it's like
Better
anything
to
else,
learn it now, right?
You either get ahead of it and learn about it and educate yourselves on it, or you get hit by it.
Yep.
And I was going to say, coming from medical device background and pharma background myself, it's great when you can work with the FDA proactively, because then you can help shape what that regulation looks like.
Right, which is both exciting and terrifying at the same time, right?
So speaking of exciting and terrifying, you have a full-time job. Your
do.
husband has a full-time job as doctors in at WashU at the School of Medicine. You have children,
We do.
and you have this company.
Yep.
So being excited by technology and also then taking that excitement and deciding to actually launch a business. What has that journey been like?
Yeah.
And was that like a no-brainer for you, or was that a, oh my God, entrepreneurship thing for you, or...
Right, so this was not in the life plan, right? 5 years ago, this was not part of the life plan.
I'm thinking holograms probably weren't. And then, so from there, everything that extends is sort of now write your own script, right? Choose your own adventure.
So a lot of it was educating,
Okay.
right? And so we've been very fortunate in that the right people have been put in our path at the right time, and they've been fairly patient with us and educating us about things. And, I definitely speak for my husband and myself when I say that we both kind of came to the point where we realized that this had to be done right.
Right.
And we felt that we needed to be a part of it to make sure it was done right. This wasn't something we were willing to hand off to somebody else.
Right.
This was something that was, it too much became part of what we were doing every day.
Right.
For it to be a handoff.
So is there a difference between what you envision for yourself as a clinician using this technology and what you envision for the company in deploying this technology?
Well, there has to be, right?
Right.
So, and it's tricky because the clinician in me wants to just use it right now. And part of that whole education process for me is going through things like conflicts and learning about that and how to have these safety nets and safety walls for the company, for the patient, for myself.
Yeah.
And so, while I'd love to go in there and do my cases on Friday,
right,
using this technology, the fact of the matter is that this is one of those times where rather than being the first to use the technology, I'm going to probably be in that second wave.
Interesting.
But at the same time, I'm getting to steer and shape the technology in a way that I think is going to be most useful for my peer group.
So what's been the feedback from your peer group, from people, especially those that are using the technology right now? Because they're using it in children, right?
Yeah, so we've done 10 to 15 patients, pediatric patients, and we've done it in an observational study. So what that means is that we've had the patient going through their procedure the way they would standardly go through it, and then a second team watching the procedure through the HoloLens.
Okay.
And so it's been used in that respect. It has been used in humans, but we haven't used it to make patient decisions yet.
Okay.
So that would be the differentiator that I would.
That's a big one.
Yes, and it is important. It's important for consent purposes, for IRB purposes, and of course for the FDA. But the feedback that we've gotten has been really positive. And what's been most interesting is how much people feel like they're continuing to learn now.
Does it feel awkward for those clinicians that, I mean, they're using a totally different technology? They've got now this I don't want to call it a bulky, but it is.
It's a headset.
It's a headset that
it's not small, not yet.
Right. Do they feel they're in a foreign in performing
How does
this
it feel for them?
Yeah.
What is the feedback on that?
So remember I told you that this is a young field?
Yeah.
So by nature, these are people that have to be able to adapt. And so in a lot of ways, it was incredibly fortuitous that John and I came up with this to use it in cardiac electrophysiology, because that's what we do.
Right.
But it turns out it's also the right technical space. It's probably the exact right first user group.
Wow, that's great.
And so it just, again, it all happened to align to just work out just so. So yeah, so people put it on and they're like, well, this is a little heavy. And then you put on, and then you show them a hologram, what they're looking at and what they're doing. And all of a sudden you forget how heavy it is on your head, because
you're so immersed.
The value add, far outweighs the slight discomfort of having something on your head.
Do you guys seeing this translate into other types of surgeries, using it in other? Yeah.
And is that the vision for Sentir? I would imagine it's just
eventually
first testing in this space where you're at home and it's native to you, and then
that's right, and where it's most comfortable. But there's certainly other parallel spaces, and I think that what we're learning in electrophysiology is going to be directly translatable to some of those other spaces, and so it's important for us to learn those lessons. Certainly regulatory is one of those important lessons to learn as we're moving forward. But then we have the advantage of being at a nationally recognized medical center. Right? And so we can leverage all of that talent and all of those good ideas, take the lessons that Sentir is learning and sort of marry those two together.
So you're clearly, I mean, your eyes light up when you talk about your work, whether it's about the kids and surgery or it's about applying this new technology to it. Do you ever see yourself fully transitioning out of clinical into running your business, growing your business, being the entrepreneur facet of yourself 100%? Or
I think that I don't know what I didn't know what 5 years was going to look like 5 years ago.
Amen.
I'm not sure what 5 years is going to look like moving forward. What I know is that there has been historically this perception when you're in medicine, particularly in clinical medicine or in academia, I think in general, that industry is the dark side, right? And so you're either on the path of the good,
or you cross over
industry, right? And I think that that's going away, and I think it's going away because people like us are saying, well, but wait a second.
It doesn't have to be one or the other. They can both be doing good.
It's not binary, and they're not exclusive.
It's not a binary choice, right?
Right? I can do a lot of good for a lot of patients doing this. And then it becomes a question of what's my value add? As long as I'm contributing to Sentir and moving that story forward, then I stay involved.
So as we wrap up our time together, what is the next chapter for Sentir, or what's the chapter you're in right now that you're writing as we speak?
Yeah, we're deeply writing an FDA chapter.
All right. Well, it's a regulatory, and a little bit more regulatory.
It is. So we're hoping to have a big push on the regulatory and do some true in-human studies by the end of the summer, which will be an important part of our regulatory package.
And I know that Harry with Biofundamentals has been working with your organization, correct?
Yes, and with me personally. Okay. He was a big part of our education as to what entrepreneurship is and what being a founder is.
Well, and that's why BioSTL Fundamentals exists, right? So that we have these places where people can get the support that they need.
Yeah.
That's what I was mentioning. Yeah, because I think that especially people who, coming from your background, it's almost like, I don't know anything about business. How do I translate this? And that's, I think, the value of what Harry and his organization brings to the table.
I think it's really important.
As well as identifying other members, other team members for your organization as well.
Yeah, so I think that there are multiple layers where you get that sort of help. I think the first is this idea actually something that we can turn into a business? And that's a hard question.
That is a hard question to answer.
Right? Because we all love our ideas.
Right.
Our ideas are genius.
And there are babies.
They are. And so it's hard to tell somebody that their baby's not beautiful.
We know.
So there's that. There's that, the first layer. And then it's learning about what is it actually going to take to start a business,
right?
And then how do I put a good team together,
right?
And then how do I develop that team and then push it all forward?
Well, as you continue to learn all those things and grow as a clinician and as an entrepreneur, we hope you'll come back and share more of your journey with us.
Absolutely. This has been so fun.
It is.
It has been
so
educating
fast.
our market on this is a technology that some people might think, oh my God, I don't even know what you're talking about. You broke this down so easily, so people understand.
Thank you. And thank you for encouraging folks to see the creative challenges and see them as surmountable and to really be intrigued with what they can do in novel and new ways. So thank you for spending time with us.
Thank you.
Changing the way you view new ventures, igniting your thinking about entrepreneurship. It's Entrepreneurially Thinking. Get connected and discover more. Visit our website for show notes, resources, information about our guests, upcoming events, and of course, all your favorite episodes. If you have any questions, be sure to leave them for us in the comment sections, and be sure to leave us a 5-star rating on iTunes. The best way to show love is to share. Let everybody know that you're thinking entrepreneurially. So visit our website, entrepreneurially-thinking.com. #ETHINKSTL. Entrepreneurially Thinking is another positive production of Rare Gem Productions. Thanks for listening.